to put roses on our graves.
High school teacher in Dallas ISD. Last week, I participated in a car caravan news conference my union of Alliance AFT held before yesterday's school board briefing. Our goal was to sound the alarm of the dangers of returning to school for in-person learning in just a few weeks amid the COVID-19 pandemic. At the board briefing that afternoon, Superintendent Dr. Michael Hinojosa reassured the board that despite Ken Paxton's non-binding opinion that county health authorities couldn't order schools to be closed, Hinojosa would be seeking advice and following counsel from Dallas County Health and Human Services. When I heard this, it made me feel a lot better and more optimistic that my students, my family, and my community may have the chance to stay as safe as possible. I have been thoroughly impressed with Dallas County's readiness to take this pandemic seriously and not rush to reopen anything. As long as Dr. Hinojosa keeps his word, I feel that we as teachers, along with our students and community, may actually be protected. However, this issue is too important for me to sit back and assume that everything is fine now. I'm speaking today to re-emphasize the state. I teach in Oak Cliff, where some of the hardest hit zip codes are located. Students often work in the service industry. Many have parents who are essential workers. Lots of them live in multi-generational households. They're already forced to take risks. If we go back to school, that risk will be compounded greatly. Teachers will bring illness home to their families, then out to the essential workers when we run errands. Students will bring it home to their elderly family who are much more at risk, or to their parents who then bring it to work with them. It's not just a hypothesis that this will happen. The canary in the coal mine has been positively screeching from Mississippi, Georgia, Florida, and any other district that has tried to reopen schools. It feels like I see new articles every day about schools that open, quickly have students or staff who test positive and simply must close again. We can see that this doesn't work. Instead of thinking that our district will somehow magically be different, we need to learn from its mistakes and protect our whole county by letting staff and students stay home, stay safe, per the county's recommendation. I hope that the county also advises Dr. Hinojosa that teachers should not report to campus to teach, even if the students aren't there. Between the shared bathrooms, the poor ventilation, the complications of not every teacher having a classroom of their own, and the general interaction that may happen, this would be absolutely needless. Teachers are professionals and can work from home like so many others have been doing since March. Again, this is not just to protect us, it is to protect everyone. Less exposure of anyone is less chance of spread. Thank you, Clay Jenkins, Philip Wong, the Commissioner's Court, and the many workers at the Dallas County Health and Human Services for your leadership during this time. Please continue what you're doing, and please advise Dallas ISD to keep school virtual until there are 14 consecutive days of declining cases in the county, less than a 5% testing positivity rate, and less than 1% transmission spread. Let's get through this together as quickly as possible. Thank you.
I'm a teacher in Dallas County, and I'm a member of Alliance AFT. So I'm speaking to you today to urge that Dallas County extend its public health order requiring school buildings and health centers to be closed for in-person instruction. We must stick to health guidelines provided by the World Health Organization and CDC regarding the reopening of physical spaces, including a 2-week drop in new COVID cases, 2-week drops in hospitalization, fewer than 4 positive cases daily per 100,000 population, at least 150 tests daily per 100,000 population, less than 5% test positivity test rate, less than 1% transmission test rate, and at least 40% available ICU bed capacity. There's too much at stake for us to reopen before these metrics have been met in Dallas County. The lives and health of our students, teachers, support staff, administrators, and family members are too high a price to pay. There is no way teachers can do their jobs as safely as our essential workers have during this crisis. Our school buildings are old, many lacking proper ventilation. These spaces were designed to be enclosed social environments in which people spend 7 to 10 hours a day in densely crowded spaces where social distancing is not feasible. And with PPE being in as short a supply as it is, we are rightfully skeptical that our districts and the TEA will be able to adequately supply our already underfunded schools the PPE we need even once the metrics we are demanding have been met. Furthermore, we cannot let our schools become the next major source of community spread. This would make the jobs of our essential workers even more risky than they currently are, and elicit the need for further ratcheting down of the economy. Thank you for your time.
I'm a Dallas County resident, voter, and Dallas ISD, and an executive board member of ISD. I'd like to speak to you about the COVID-19 update. That means that we reopen the schools to the following metrics. 14 days of declining new cases and hospitalizations, positive rate of less than 5%, and transmission rate of less than 1%. As you have seen on the news, many districts have opened up in person and had disastrous results. Yesterday, Wednesday, Chapel Hill announced that they would be going virtually due to 135 new visits. These are adults who should be able to follow special guidelines. Yet people expect school-age children, as in 4, 5, and 6-year-olds, to adhere to them. How? Especially if adults barely can. Meetings are being conducted virtually. Corporations are having a break from home. Prisoners are being sent early. Why? Because it's not safe. Yet many people have no problem urging schools to open and send children into buildings where they will be packed like sardines, essentially turning them into people spreading. Some of our high schools have over 300 staff members and over 4,000 students. That is 4,300 people in one building, and it has over 200 schools. How are we going to maintain social distancing when it's not physically possible? You heard Dr. Wong today that with me upon him, we will be overall confident, not if, but when our numbers begin to rise. I just reported that in Dallas County, we have had 10,000 people die from COVID-19. How many more have to pass away in order for us to keep our children safe? I'm asking you to advise our district not to open school buildings until we have passed 14 days declining cases and hospitalizations, positivity rate of less than 5%, and transmission rate of less than 1%. I thank you for your leadership in this time. Allow me to speak. Thank you.
I'm a school teacher and a resident in the Dallas County. First of all, I want to express to Judge Clay Jenkins and Dr. Phyllis Swan my gratitude for your leadership and sound advice to the Dallas County community and for being a voice of reason and calm in the middle of a crisis when the world seems to be falling apart all around us and our elected officials at all levels of government are failing us. You have been the voice of reason, giving us the confidence that together we can get out of this mess. I'm here to ask for you something simple, that you continue to help us keep our community safe by extending the public health order to keep school buildings closed to all but essential personnel. We ask that you keep this public health order in place until Dallas County has these 5 basic criteria be met at the county level before any local ISD is allowed to reopen schools for face-to-face learning. In order to ensure safe and sustainable reopening, we're asking, number 1, to 2-week average drop in COVID cases. Number 2, fewer than 4 positive cases daily per 100,000 population. Number 3, at least 150 tests daily per 100,000 population. Number 4, less than 5% test positivity. And number 5, at least 40% available ICU bed capacity. Only recently, the numbers of COVID have started to go down. If we reopen face-to-face instruction, we risk losing the battleground just recently gained back against this virus. You know what keeps me up at night? It's not me getting COVID. It's unbearable death and irreparable loss around me. A fellow worker on the ICU, a widowed teacher, a child losing a parent, or a teacher's worst nightmare, a young student life cut short. We don't need a crystal ball to know what the future holds for us. We can look at Florida and Georgia and what has happened with all the schools that open for in-person learning when positivity rates and transmission rates are too high. They get spikes in COVID-19 cases and they are having to close schools. By extending the health order, you will ensure that schools don't become the next source of majority community spread of the virus we have yet to contain. Thank you once again for all your guidance and leadership.
I have been motivated to make sure, since this pandemic started, that we have a proper plan in place before going fully back to school. I have also, like other speakers have said, been encouraged that Dallas has been willing to take this pandemic seriously, including the leadership of Judge Clay Jenkins and Dallas Commissioner Court. And I hope that whatever plan that we do have in place would include World Health Organization's recommendations that 14 days of, include the metrics of 14 days of declining new cases and hospitalization, positivity rate of less than 5%, and a transmission rate of less than 1% for opening school doors. I'm hoping that Dallas County officials tie these metrics to the reopening of school buildings. We have seen in real time what happens when schools open up too early in states as varied as North Carolina, Indiana, and Georgia. I know that for Dallas officials, this seems like an impossible situation to govern. In my neighborhood, most of the parents of my school are lower working class who work 2 to 3 jobs to take care of their children. I saw last semester how difficult it was for them to work as well as tutor their kids in an all virtual learning environment. So I'm not asking this out of any kind of selfish gain to stay home or whatever. I'm a teacher. I love being around students. I love teaching. However, knowing my school, knowing how old the school is, how it doesn't have a proper circulation system for air, that lacks basic resources, even though we're working on that. I feel like it is only a matter of time before we close down anyway due to COVID, and I do not want any child to have to deal with the disease if it can be helped. I have personally dealt with this COVID disease in my own family, with my brother-in-law almost dying from it, and I do not want any child to have to deal with it, or any parent to have to deal with that. So I'm hoping that Dallas officials make the right call and extend or delay the reopening of school buildings until these metrics absolutely 100% be implemented. Thank you, and I thank you so much for your leadership during this time. I do appreciate your willingness to let me talk. Thank you.
On July 24th, the Centers for Disease Control gave into pressure to issue weaker safety guidelines for reopening schools during the COVID-19 pandemic and urged an in-person return to schools. These latest guidelines downplay the dangers to students, educators, and the community. While the plans detail the benefits of in-person schools for children and claim that open schools are the key to reviving the economy, they contain little scientific basis to guide reopening nor facts about the risks for doing so. The latest shift in CDC guidelines comes as the pandemic worsens. Cases, hospitalizations, and deaths are surging yet again. COVID-19 cases in the U.S. have shot up to 5.6 million, and our death rate is averaging 1,000 per day. Recently, we passed 173,000 deaths in the U.S., the most of any country. The rates from COVID-19 deaths among Black people is 3 times higher than among whites and disproportionate amongst all communities of color. Weakening safety guidelines for schools that are supposed to protect children would force families to choose between health and their right to public education. If you reopen the schools now, you are putting the health and lives of our children and the workers caring for them at greater risk. In July, a leaked internal CDC document cited reopening schools as the highest risk for the spread of COVID-19. Schools are inherently designed to be contained social environments, and many of our school buildings are old, overcrowded, and lacking in proper ventilation. Dallas must institute a number of measures to ensure the health of students, teachers, families, and our communities. We need free universal testing, planned contact tracing, public health education, and we need every school and workplace that meets federal, state, and local COVID-19 safety guidelines. Not only that, but the society in which our schools are situated needs a moratorium on rents and evictions, large-scale financial relief for working families, and an extension and expansion of food assistance and unemployment. It's up to educators, schools, workers, students, parents, and communities to organize at every level we can to make sure our communities survive the pandemic and the depression. Everyone wants students back in the schools, but not at risk of losing lives. It is not safe until there is scientific consensus that COVID-19 has been contained. By reopening our schools, you are not doing what you can and should do to address the crisis. To the Commissioners Court, we ask you please continue to help us keep our community safe by extending the public health order to keep school buildings closed to all but essential personnel. We ask that you keep this public health order in place until Dallas County has 14 consecutive days of dropping COVID-19 cases and hospitalizations, positivity rate of less than 5%, and a transmission rate of less than 1%. By extending the health order, you will ensure that schools don't become the next source of major community spread of a virus we have yet to contain. You cannot push this crisis onto working people, and it is the government that bears the responsibility for not implementing the programs and solutions necessary to truly confront the crisis. Thank you for your time.
I'm a Dallas ISD teacher, as well as a building leader and executive board member of Alliance AFT, the largest union representing DISD employees. I teach at Sunset High School in Oak Cliff. First and foremost, thank you for your work to protect all the residents of Dallas County. I'm speaking to ask that you advise Dallas ISD to remain virtual in light of our case data, our delays in testing, and our recently reported state coding errors. Many of our schools experienced challenges with ventilation and overcrowding well before the pandemic. A significant number of our active classroom teachers belong to high-risk groups, and this is especially true for our substitute teachers who are more likely to be retired. There are a number of unanswered questions about how our bus drivers, monitors, and other support personnel will be protected should campuses physically reopen. And in a district like ours, where so many households are multi-generational, reopening poses additional serious risks that are not limited to the campuses themselves. We ask that these basic criteria be met at the county level before any local ISD is allowed to reopen schools for face-to-face learning, in order to ensure safe and sustainable reopening. A 2-week drop in COVID cases, fewer than 4 positive cases daily per 100,000 people, at least 150 tests daily per 100,000 people, less than 5% test positivity, less than 1% community transmission, and at least 40% available ICU bed capacity. Many of us have already suffered losses to COVID. We've lost family members, we've lost coworkers and students to this virus. Please work with our school district union to ensure that the reopening discussion prioritizes human life over politics and profit. Thank you.
I am a Dallas ISD teacher and I live in Dallas County. I am married to a public school teacher and I have 2 children who attend public school. My family is 100% invested in public education. I am speaking today out of concern for my students and their families. My students are my reason for teaching. They are passionate, smart, and so eager to make their mark in the world. My school is low SES. These students and their families are among the most affected by COVID-19. They are more likely to live in multi-generational homes, they are more likely to be hospitalized, and they have a higher mortality rate. The school where I teach was built in 1964. The classrooms in our main building are tiny, moldy, and without working HVAC. When it is hot, temps in our building can reach 90 degrees. I have 7 classes on a 95-minute block schedule. In a class of 30 students, I do not have room to open cabinets, let alone to social distance. I have watched my students' faces turn red from the heat and listened to their pleas to have class in the hallway because they were so uncomfortable. These are the conditions that we will be returning to when you reopen schools. How can I welcome these bright young people into an environment that I know is unsafe? How can I protect these children from an airborne virus when I don't even have working AC in my classroom? Even though young people are more resilient to this virus, they risk passing it on to grandparents who live with them. How can I be complicit in decisions that could take away the only support system that some of these kids have? Judge Jenkins, I urge you to follow the science when you reopen schools. Specifically, I am asking that you mandate virtual instruction until 3 conditions are met. Positive cases and hospitalizations fall for 14 consecutive days. The positivity rate is less than 5%, and the transmission rate is less than 1%. If we reopen schools knowing we did so before the science says it was safe, the lives and livelihoods lost are on all of our hands. In Dallas ISD, we pride ourselves on being data-driven. The data is clear. If we reopen now, we will increase community spread, burden our straining hospitals, and risk another more costly and chaotic shutdown. Dallas is a growing city with a large urban school district. Our decisions set powerful precedents, not just in our great state, but nationwide. This is a chance to be led by science and to lead by example. Judge Jenkins, in closing, I believe your proactive approach to this virus has saved lives. This August, you have an opportunity to save the lives of some of our most vulnerable citizens. The responsible choice may not be the most popular, but it is certainly the most moral. I am looking forward to a time when it is safe to be in my classroom with my students again, and I will do everything within my power to ensure that we reach the necessary benchmarks as quickly as possible. Thank you for your time.
No, please don't forget to put roses on our grave.